Your child wakes up screaming that their throat hurts. You rush to the doctor and get a rapid strep test. It comes back positive. But here's what most parents, and even some doctors, don't realize. There's a 30% chance that test is giving you a false positive. That means your child could be about to take antibiotics they don't need for a condition they don't have. Even worse, most parents can't tell the difference between strep throat and a viral sore throat, leading to over 11 million unnecessary doctor visits every year. And I'm going to teach you how to spot the difference and protect your child from antibiotic overuse. So, why do we treat strep throat so aggressively when the sore throat itself usually clears up in 3 to 5 days? 2 words: rheumatic fever. If strep throat is left untreated in about 3% of cases, the immune system makes a catastrophic mistake. It attacks the body's own heart valves, joints, or kidneys. This happens because the antibodies meant to fight strep mistakenly recognize the body's tissues as foreign, a process called molecular mimicry. Treating strep with antibiotics reduces the risk of rheumatic fever by 95%. But timing matters. Treatment must start within 9 days of symptom onset to prevent heart damage. If your child has high sudden fever, think strep. Cough or runny nose, that's almost always viral. Headache or stomachache, more common with strep. White or yellow spots on the tonsils and a beefy red throat, that points to strep. Mild redness, small blisters, or congestion, that's viral. If your child has a sore throat plus cough, runny nose, or congestion, it's almost certainly viral and does not need antibiotics. The American Academy of Pediatrics recommends testing only when certain criteria are met. Fever above 100.
4 degrees Fahrenheit, no cough, swollen tonsils with pus, and tender neck lymph nodes. Children should only be tested if they're older than 3. Strep is extremely rare under that age, and rheumatic fever is even rarer. Rapid strep tests can give up to 30% false positives, meaning they say strep is present when it isn't. If your child's test is positive but they're already improving, ask your doctor to wait for the confirmatory result before starting antibiotics. If your child has a sore throat plus cold symptoms, assume it's viral and skip antibiotics. Instead, focus on comfort and care. Use ibuprofen or acetaminophen for pain and fever relief. Keep them hydrated with cool drinks, ice pops, or warm broth. For older kids, saltwater gargles can ease inflammation. Use a cool mist humidifier to soothe the throat. Offer soft, easy-to-swallow foods until they feel better. Most sore throats, about 70%, are viral and need no antibiotics. The real goal of strep treatment isn't to cure the sore throat. It's to prevent rheumatic fever. So remember the simple rule: no cough, no congestion, test for strep. If there's cough or a runny nose, it's viral. Treats symptoms, not bacteria that aren't there. You can save your child an unnecessary round of antibiotics and help protect their long-term health by knowing when to test and when to trust the body's natural healing.